Focus for a moment on the drug stocks. They're on your screen now. We're doing this because Donald Trump says he is going to lower drug prices. Our next guest says if he does that, that's a very good thing. Look who's here. Dr. Manny Alvarez. He is the senior managing editor of FoxNewsHealth.com. Manny, welcome back.
Welcome.
Let's make the assumption for a moment that Mr. Trump can indeed do what he says he's going to do and drug prices come down. Can you give me an example of where you think this would literally save lives?
Listen, right now the problem that we have is that prescription cost is out of control. Out of control at all levels. Yeah. We don't know what the cost is at the pharmaceutical level. Then it gets to retailers. They have to mark it up. Then you have insurance companies deciding what the price is. You have hospitals marking up 4 times to 5 times what their cost is. So imagine, let's say you paid $10 for a bottle of Tylenol, but you get it in the hospital. That's a $50 bottle for the consumer. So everything, the point, the price, nobody could tell you what the price is. What we all know is that the markup is astronomical, in the hundreds of percentiles.
Well, is that what he's talking about? Is he talking about getting the markup down?
Look, this is the only industry. You have a product that nobody could tell you how much it costs to manufacture and what the proper markup should be. Right now, the pharmaceutical companies, I've spoken to everybody about this segment, and everybody says, well, Manny, the bottom line is that the farm companies just come up with a price, and we don't know what the price is, and every year it goes up. So what happens, when I wrote the article in FoxNewsHealth.com that I said Trump is going to save lives, that is true. People cannot afford to buy their medications today, even with insurance. So what do? When you have a copay of $500 to $600 per month to get your basic prescriptions, your blood pressure medicine, I'm not talking about even cancer drugs.
This does happen. This does happen,
every single day. Every single day. So what do? Well, you had a bad month this week, you don't have the $500 copay, you don't renew your prescription. So, and I'm talking about the basic stuff. I'm talking about your diabetic pills, which are $10 a dozen for 1/3 of America, your blood pressure medication, $10 a dozen for 1/3 of Americans, your cholesterol pills, okay? That's the basic stuff. The bread, the butter, the milk, the things that you need to continue living in this world. And the American consumer sometimes says, you know what, this month I'm not going to renew my medication. So this has to stop because look at the mortality rates that just came out yesterday. Look at the mortality rates.
Now, I'm going to get to that in a second.
Yeah.
But I've got to be in my bonnet about the activities of lawyers within the medical industry.
Right.
What you've been talking about right now, you're talking about the markup between the pharma company and the end user, myself.
Correct.
A lot of that markup is because of the threat of lawsuits. And I think that if you did something about that, I don't know what you could do, but you do something about that and you really change things.
As a doctor, this has been one of my hallmarks. We need some sort of tort reform that makes sense. I think every industry, from automobiles, auto manufacturers to pharmaceutical industries, they'll tell you, listen, we need some tort reform. But I think that that is not the biggest problem for the out-of-control cost.
What is?
I think it's just corporate greed. Number one, I think. Well, look at the generic companies. The generic companies have increased, right? Generics came out in the market, God knows how long, and everybody said, "Hooray! Generic drugs is going to lower the cost." Yeah. Generic drug manufacturing cost has increased every year for the last 8 years. Generics. So even the generics have gone up. And when you look at the generic business, sometimes they open a small pharmaceutical company, they close it down, everybody takes whatever they need to take in their pockets, they reopen it again under another label, and it goes on and on. I understand business. I am all for business. I get it. But this is an industry out of control, and I think this is why the president-elect is going to be great in dealing with this.